There have been various trends within the health industry, from various scans to platelet-rich plasma and even personalized medicine. So what is personalized medicine all about, and how can it benefit you? We've invited Dr. Danny Meyersfeld into studio to chat to us about this and genetic testing as well, because that's become a buzzword nowadays. But let's take one step back to personalized medicine and why people should be interested in it.
Personalized medicine, if I had to sum it up, is the realization by healthcare practitioners that every patient that walks into their rooms is an individual and needs to be treated as an individual. That the health outcome, or the health intervention rather, that leads to a positive outcome in one case, that same intervention is not necessarily going to be optimal in another case. With genetics, the doctors have the power to better understand their patients' requirements for optimal health outcomes, and they're therefore using it as a tool in practice to assist their patients on their health journey. Yeah,
so you hear about nutrigenomics, and you know, some people are skeptical still. They say, well, you know, how's that going to help me if I know what genetic predisposition I have?
Yeah. I've been talking about this for 10 years now.
I know.
and in the early days, we used to defend it a lot, and had a lot of people saying it's too soon, it's too soon. And 10 years later, we still occasionally hear too soon. We still do.
Wow.
We still do, not as often, but I have less tolerance now for entering into the debate, because there's just so much evidence and so much literature around the association between your genes and the outcomes that it's not really worth entering into the
I suppose some of the questions we get are, that's where I could be or where I should be, but it's not where I am. So how do I build that bridge?
So your genetics shows your potential. Now, we can't change our DNA, but what we can do is we can modify gene expression. This is one of the big findings that came out of the Human Genome Project, was the fact that there's a strong link, a strong interaction between the genes that we have and the environment in which we place those genes. So by modifying our environment, which we can only do through knowledge of our genes, we can modify gene expression. And
so this is epigenetics, right?
Correct.
Yeah. Correct. Okay, so let's talk about, you know, let's actually go into some of that research, the types of genes, for people that don't know what the Human Genome Project was about, just so we can set a nice tone for it.
The Human Genome Project was an international collaboration that was started in the 90s, and the first draft of the sequence was published in 2003. And what the project was an effort to read the book, read the DNA code that exists in every single one of our cells. Our genome, which is this DNA code, consists of 3 billion base pairs, and the Genome Project put these base pairs into order, essentially read this book, and then set about identifying the genes that make us who we are. So that was what the Genome Project was.
Somewhat deconstructing the puzzle, right? So that we know how to put the puzzle pieces back together again.
Better understanding who we are, what makes us who we are, what makes us unique.
So nowadays, when I say, you know, I'm getting my genes tested, is it for certain diseases? Is it for foods that will benefit me and certain diets that will benefit me? Let's talk about high penetrance genes and low penetrance genes as well.
So you've been doing some studying.
It's what I love to do.
So what's happened since the Human Genome Project is you can no longer lump genetic testing into one basket. There's so many different types of genetic testing, from in utero genetic testing to look at the potential for disease risk in a fetus, to you know, looking at your ancestry. The Human Genome Commission in the UK classified 11 different types of genetic testing. The type that we're interested in is the space called Nutrigenomics, which is a combination of two words, nutrition and genetics. And it's really how we can personalize nutritional requirements for an individual based on their genetics.
Okay. So you've been doing this for 10 years. What advances have you seen in the industry, and how have these tests changed? What's improved? What's made the science more robust?
I think that the advances have come on 3 levels. First, the technology is available to us within the laboratory. So in terms of us, our ability to analyze the genes and to have high throughput processing of the patient samples, the cost has come down substantially, making it more accessible. The consumer awareness has increased massively.
True.
People are talking about it, as you said at the beginning. Everyone's saying, I had this DNA test, this is what it told me. And this is one of the things I wanted to achieve, is to create this, also narrow this gap between academia and the man in the street actually benefiting from that academic research. Because there's so much knowledge sitting within the academic space. But how does that translate into something that is practical and applicable within a clinical environment?
Setting,
a clinical setting. And then, of course, the research has continued within the academic environment. So we know about more genes and more gene associations. The evidence behind the genes is getting stronger and stronger. And so we're able to continually update the information that we give people, advance our tests, add more genes into the test, report on more things, more outcomes, more interventions.
And I suppose also what's changed is, the way in which information is packaged for the consumer so they know what to do with that information.
It's all about what you can do. That is the key thing, is we are giving you information which by itself would be meaningless, but within the context of a healthcare environment where a practitioner can take the information, make it applicable to you, and give you the interventions to actually do something with that information, that's where it becomes powerful.
Often we think the best labs, the best technologies outside of South Africa, but when it comes to genetic testing, we're forerunners actually. We
receive samples in my lab from 30 countries around the world.
Yeah.
So, we've put together tests. We learned a lot when we set up the test. We learned from companies that had been established and running overseas. We set about to do things in a certain way that's appealed to healthcare practitioners. And we're certainly getting a global reputation now and dealing with countries all over the world.
So next up, we find out more about the benefits of genetic testing and what to look for when deciding if you want to do one. We'll see you in a short while. If you've just tuned into the show, we're continuing our chat with Dr. Danny Meyersfeld, and we're talking about genetic testing and what makes you passionate about genetic testing.
So I came from a medical research background.
Okay.
I did a PhD in molecular biology, actually doing malaria research at Wits.
Wow.
I did the PhD, I did 2 years of postdoctoral research there. And then I sort of came to a point where I knew I wasn't going to spend the rest of my life in academia. And I started looking for opportunities outside of academia.
Yeah.
And I'd sort of seeing the trends in healthcare globally move towards personalized medicine. None of those technologies were available in South Africa. So I thought, well, there's no reason why doctors in the States and Europe should have access to these types of technologies when we've got the personnel here, we've got the brain power in South Africa.
Yeah.
Let's set it up and give this to local doctors as well. So it is complex, and the healthcare practitioners that we work with have all done training with us on how to interpret the reports. And it just adds immense value within that clinical context to bring the genetics in.
Yeah, certainly. Okay, so let's look at some of the tests that you have available, and let's just chat briefly about them. I mean, I've done DNA Diet, I've done DNA Sport, Genehealth.
Those are three of the most popular tests.
Yeah.
The names are pretty self-explanatory.
Yeah.
DNA Diet is geared specifically towards weight management, so we're telling you which diet type is right for you. Dieting is very faddish in a way, in the sense that if one diet doesn't work, you jump onto the next one, and if you don't get the results quickly enough, you try something else. So what this does is it looks at your DNA and it tells your dietitian, this is the diet type that's going to work best for this person. It might be that there's certain barriers to overcome genetically. It's going to take them longer to lose the weight. They might require high intensity exercise along with it, but it just personalizes the dietary interventions that a healthcare practitioner can
point you in the right direction. Right. So is Genehealth the foundational test to start with?
I think it depends on your health priorities.
Okay.
Weight is a big part of health. If you are overweight and you need to lose weight, then by all means do the diet first, get your weight sorted out, and then you can start looking at the health, which becomes more the maintenance, where are my health priorities from a chronic diseases of lifestyle perspective.
Yes.
Bringing in the optimal nutrition, anti-inflammatory foods, that type of thing. So it's very much cholesterol risk, bone health, how we detoxify in the liver. It's these molecular processes that are happening in our cells which are so important in determining our overall health.
There's also an estrogen test.
Estrogen looks, it's sort of a detoxification pathways, but specifically of estrogen. If estrogen is not broken down properly, not cleared properly in the body, the breakdown products become carcinogenic. So some women, for example, would be at increased risk of breast cancer in the presence of hormone replacement therapy or that type of treatment.
Okay.
So, and it looks at those pathways. DNA Sport is the other one you mentioned, which is around exercise and training. It looks at risk for soft tissue injury, power versus endurance potential, how quickly you recover from high intensity exercise. So it's about, again, subtle often subtle changes or enhancements to a training program.
I mean, it's beneficial for some athletes as well, but I think it's DNA sport. The word sport shouldn't put people off, because if you are choosing to embark on a certain type of training regime, it actually will point you in the right direction for something that won't end up, frustrating you because it didn't work or you didn't respond very well.
I think that's the thing. We're all busy.
Yeah.
And unless you're a professional athlete, going to the gym and training is never going to be your top priority. You want to know that when you're in the gym or when you're on the road or on your bike, whatever you're doing, you're getting the most sort of bang for your buck. That time spent is optimal. And if it means that if you've got genetically more great power potential, then bring in power type high intensity power training rather than the long endurance training. It doesn't mean you need to change your event or you can't still cycle the 94/7 or something, but the time you spend training can be optimized based on that genetic potential.
True. Okay, and then you've got skin, mind, and then
MedCheck.
MedCheck. There we go.
You keep adding tests. I've got to kind of remember.
Love it.
Skin is very much on the aesthetic side. It looks at the genetics behind skin aging.
Okay.
Risks for wrinkles, UV exposure, sagging, that type of thing. Around optimal nutrition, optimal topical interventions for skincare.
Okay.
Mind looks at cognitive health. So it's risk for mood disorders, risks for addictive behavior, and risks for cognitive degeneration. Things like late onset Alzheimer's disease. The key with all of these tests that we look at is we are giving you the tools to affect the outcome. So we're not giving you the information saying we're sorry, there's nothing you can do.
Yes, exactly.
That's where you mentioned earlier the low penetrance versus the high penetrance. These are all low penetrance markers. By themselves, they're not enough to bring on that disease outcome.
Yeah.
But in the wrong environment, with the wrong exposures, that's where that risk is increased.
The MedCheck, let's
MedCheck looks at responsiveness to prescription medication.
Okay.
So it covers over 150 different drugs across pain, cardiovascular, and psychiatric medications. And the idea is to tell the doctors which drug is going to be suitable for their patient. If you're embarking on if you're going into a chronic medication, you're going to be taking that medication the rest of your life. Make sure that you're minimizing the chance of side effects and maximizing the chance of efficacy.
Yeah.
The drug needs to work.
So how do people know what's the right, where's the right place to go? What type of decisions they should be making? What's the process?
Okay.
I
would say if I was embarking on this for the first time, looking for a company to work with or where to do a genetic test, one of the most important things is transparency. You want the company to be able to tell you which genes they're looking at, why they're looking at those genes, show you the research behind those genes if they're available. Know the people, look at the people behind the company, see that they're credible, reliable people behind the company. If people are trying to flog supplements, I would say that that's immediately a red flag, that there's another agenda at play. And I'd be cautious of selling direct to consumer or online. I think that our view is that the healthcare practitioner has immense value to add, that the value of the test direct to consumer is vastly diminished. You don't get as much information or as much value out of it.
Okay.
So if you're going to spend the money, see a healthcare practitioner and let them manage your health journey.
So the process would be to go onto the DNAlysis site, find a practitioner that's in your area, and then see that practitioner and order the test. Is that your and is that your holistic process?
That is the process that 90% of the people will follow.
Okay.
They can also come directly to us. Our offices are in Ilovo. They can come to us to get the swab, and we will appoint a practitioner for them.
How do people get hold of you and get more information?
The web address is dnalysis.co.za or medchecksa.com.
Okay, fantastic. Well, thanks so much for coming to chat to us about it.
Thank you.